Right. Let's get going. Welcome again to the call. We're entering into our period known as end-to-end review. We'll be describing what that is and what that entails and going through all the content. Next slide. Again, thanks for joining the Gravity Project community meeting. Everyone's muted upon entry, but we talk a lot as a community. The calls are recorded. The recordings are always available on the Gravity Confluence page after the call. And if you want to send information in the chat, send it to everybody, just so we can have a lively collective conversation. And I do note, as I often note, that it's a hazard to send anything directly to me because I will read it out loud. Because in my facilitation role, I cannot differentiate. So again, welcome. Next slide. We, as a standards development entity, have a requirement for following antitrust practices. And everybody who participates in these calls, including all of yourselves, have the responsibility to comply fully with federal and state antitrust laws. And we apply these decisions quite liberally. So we just ask that you not just intend to adhere to the guidelines, but also avoid anything that might be construed as a violence of antitrust considerations in our work together. Next slide. Our agenda is a quick Gravity overview. And then we'll go into Coding for Food Phase II. Just we have a couple updates. I had to last minute cancel one of our teaching kitchens meetings, so we don't have a ton of updates there. And then we have our program enhancements, program classification updates, and our program documentation updates. And again, with the Coding for Food concepts, this is where we're going into end-to-end review, and we'll talk more about what that means in the next slides. Next slide. Next slide. As I mention every time, just for orientation's sake, we meet here during our public facing work every Thursday from 4 to 5:30 Eastern Standard Time for terminology, but we alternate topics. We focus on new domains in the alternating week and enhancements here. Enhancements meaning enhancements to previously addressed domains or concepts, or enhancements to features that cross all domains. You are in the enhancements call. Coding for Food is an enhancement of our prior work in food insecurity, even though those interventions are not limited to food insecurity. And we are talking about all kinds of things regarding enhancing our program concepts here as well. The technical work stream meets every other Wednesday from 1 to 2 Eastern Standard Time. The next meeting is on April 30th, next Wednesday. They're going to be going into enhancements for our standard for trial use STU3 updates regarding standards for exchanging program eligibility and social care enrollment. Again, this is all part of our work in enhancing our IG to better meet the needs of implementers and document connection to services. My friend, partner in the good, Corey Smith, and Corinne, our program manager, will help in that, and we welcome all to come and talk through it, especially folks who can ensure that those standards are representing all of your needs as implementers. The implementation workstream meets in about a month. So the next topic is discussions in ROI with closed loop referral standards, addressing both patient and provider burden. Next slide. Any questions? All right, next slide. So we almost have a finalized new mission/vision, and the updates will go to our steering committee very, very shortly. For now, the Gravity Project vision is the Gravity Project striving to create a world where health and social care organizations readily share the information needed to effectively meet the social needs of individuals, advance health equity, and improve health outcomes in communities by using standard terminology and technology. Coming soon, next meeting, maybe, we should have the updated one. Next slide. Again, very, very grateful for our members and sponsors and partners. We have some shifts to do here just due to new members coming on and some members sunsetting off. So we'll have a new membership slide when we see you next time. Next slide. And again, this is our roadmap. We are doing enhancements right now. Enhancements were thought to be a spring-only effort, so we might have a specific call on enhancements in the fall. We don't know yet. But then we're definitely going to pick up in the fall on new domain work with our built environment domains and food access, neighborhood safety, and access to green space. Very much looking forward to those. And then, as you can see, in April, May is when the technical team is working on ST 3.0 updates, and that's all the work happening in the technical call 1 to 2. So we presented the roadmap like 2.5 weeks, so 3 weeks ago, and then next week we'll present the starting on the use cases, that eligibility and enrollment use case, and then the affinity meeting in May. Next slide. Our data use principles, always important, ever important, named every time we meet. They are improving personal health outcomes, improving population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and ever importantly, preventing, reducing, and remediating harm. You can always find any of the things we're mentioning on the Gravity Complements. The data use principles are there for reference. Next slide. What we're doing here in our enhancements call is really looking into enhancements on the intervention side of things. Enhancements in our capacity to document programs, both with discrete HCPCS concepts and the enrolled in concepts we're working on as well, and enhancements to represent outcomes, which really are the final goal, right? We don't just want to refer people to SNAP, we want to enroll them in SNAP. So that's all the left side of the screen in the intervention world, and that's what we're working on deeply in as we do in this enhancement call for the spring cycle. Next slide. Here we are, we're going into end-to-end review. End-to-end review is a 3-meeting long process where we refine concepts, right? So really the focus of that end-to-end review is coding for food, even though there is a kind of end-to-end review happening for program classification as well. So the end-to-end review lasts 3 meetings, and then there's the all terminology consensus vote on May 29th, where all the different meetings and purposes roll together for a big community meeting and vote. Next slide. So end-to-end review, and we just discussed this in the domain meeting last week, but end-to-end review is a time to step back and consider the whole set. It's a little bit different because coding for food is not, it's like concepts not in the data term sense, but concepts in the definition sense. Are there things missing from our coding for food definitions? Are there things missing from our program classification or enrollment concepts? Are there incorrect things that need to be fixed? Are there things that are necessary and should be removed? Interestingly, with the classification, we're doing that internally one final time before we give it all to you, because it has taken a year to get that draft. But the coding for food definitions are really in good stead, and they're posted on the Confluence, and they will be updates will be posted very shortly tomorrow. They're in good stead to go into end-to-end review. Any comment in end-to-end review is actually formal. So we try to represent the consensus and of the work we've done together. And so if things are to be changed at this point, they need to be changed in a formal email to gravityproject@hl7.org that specifies what you want changed and the rationale and evidence for the alternate approach. So what you think is missing and needs to be added, rationale and evidence, what you think needs to be corrected, rationale and evidence, and anything you feel like is unnecessary and needs to be removed. Again, everything that you submit will go back either to our Coding for Food work group subject matter experts, or they'll go to the program classification subject matter experts for review. Next slide. Actually, go back one slide. I'm so sorry. I just forgot. Any questions on this process? It's easier to ask the questions on the slide. Okay, simply put, we've done enough work. If there's changes to it right now, we try to document those changes and rationale very, very carefully. So the emails help. Next slide. Next slide. All right, Coding for Food Phase II. We have a couple updates here, really trying to fold in the ideas and perspectives you all have offered to date. And again, the teaching kitchen concepts are pretty stable, but the cooking tools ones has a few updates based on the last meeting. Next slide. So Coding for Food, we've gone through, it's been not quite a year of us working together, but almost. There's 2 different phases. We did medically tailored meals, produce prescription, medically tailored groceries, and healthy groceries in the fall session. And those were submitted to MIRAS, which is who makes the healthcare common procedure coding system codes in January. And we just await status there. We're in phase 2 now, working on cooking and kitchen supplies and the cooking education, teaching kitchen food pharmacy concept, which has now been simplified a little bit. Everything's available on the Confluence for review, including phase 1 early findings, and you can all find it in the food insecurity section, even though it's not food insecurity bound, because these concepts will certainly be in the food insecurity value sets, even though they don't just apply to food insecurity. Next slide. Amazing. Thanks to our Coding for Food Advisory Committee, the Foodist Medicine All-Stars, this amazing group. They've been advising the Coding for Food work along the way. Next slide. And then for every single concept, we have a subgroup, right, who are experts specifically in that thing, right? So cooking and kitchen supplies and the cooking education, teaching kitchens and food pharmacy work groups. Again, incredibly grateful for these amazing people who show up and help us refine these every other week. Next slide. There really are, in the cooking and kitchen supplies, we talked about this last time, we really had parsed it out into being two core concepts, really like 3 core concepts. One being the appliances and one being the kitchenware. The reason being is that the appliances are so consistently, they're often given, but consistently given separate and different from the kitchenware. So we wanted to take that apart. And then we also, as we'll mention shortly, needed to allow large appliances to be used not just for food purposes. And then, like we mentioned, the drafts will be available by end of day Friday. And please spread them around. And again, but at this point now, end-to-end review, ideas of what you feel like needs to change, delivered to Gravity, project@hl7.org in an email with rationale and evidence. Next slide. All right, so changes to the definition are going to be represented in bold. So the last time we met a couple weeks ago, there was a wonderful discussion really on specific appliances we were missing, examples, and we had a conversation here both in the chat and with our voices on things like tortilla presses and things like teapots and coffee. I mean, that was all in the appliances, and different types of utensils, right? And it would be really difficult to have an inclusive list of all the possible culturally supportive methods of having kitchenware. And so, and also we wanted to note that personal preferences are significant as well. And so we already had the preferences concept. And so in order to not list out every single possible adaptation to the kitchenware options, we put in cultural and personal preferences as part of the assessment. That way, you're going to see also that we also made more general some of the specific tool callouts to allow for it to represent like a way a person eats, like eating utensils, rather than forks and knives, right? And again, just to try to allow for whatever the person needs culturally or personally, the program could provide. So that cultural and personal addition was in reflection of the conversation we had here 2 weeks ago. Next slide. And also, actually, what I want to say before we go, my apologies, final thoughts. We also just really wanted to state that this assessment is critical and it can't be sidestepped. So you can't assume that a person needs, you have to do the cultural and personal assessment in order to get people the tools and supplies that they need. We didn't want it to be cut out of specific operations we didn't want the cultural assessment to be an operational option as opposed to something that's actually built into the concept. So that's why we put it in the definition as well. I hope that makes sense. Next slide. All right, so other additions, and this is again, what you can see is because we really wanted to make sure that we carried that throughput of all of the different ideas that you all had regarding missing impossible tools. For every single one of those, there is a new concept, which is other additional tools if appropriate after assessment, right? So that is cooking and serving utensils, cooking and serving equipment, pots and pans, and tableware. You can see that's been added each time. And again, that just, allows us to put things like the vegetable steamer might be included in pots and pans, right? Or different thing, or, chopsticks might be something that you include with tableware. And then we also changed, again, like I mentioned, the concept of like what you eat with to be eating utensils to be inclusive of all cultural possibilities. So that was our approach to try to integrate your thoughts. Any thoughts on this before we go forward? Refining, tweaking. This is where the phase we're at.
I have a question.
Matt?
Hi. Have you, I'm not an expert in this area, but for people with disabilities, are there specific eating utensils that we want to call out that because like they'd be overlooked, for example, uh, under the broader category of eating utensils? Do you know what I'm saying?
Yeah, so specifically with tableware, we included that parenthetical, which is not new, which is why it's not bold, which says adaptive if required. For just that reason.
Great.
Because, yeah, 100%. Oh, Jillian, hi. Okay. Okay, I'm so glad, Julian, you feel like we heard you. And all of you. I'm so glad, Marianne, you feel like we covered the things that you raised next week. And Sandra, hi. Hello.
Hello.
Welcome back.
Thank you very much. Great job you're doing here. Question about, and I may have missed this, but like you have baby bottles listed, which I'm delighted about, but are you only recommending glass baby bottles? There are issues with plastic ones, so that's my question.
Yeah, we had quite a long, and Meg can testify to this too. I see my friend Meg there. We had quite a long conversation about whether or not we could mandate or recommend specific types of plastic. We had to include options that were not plastic based, but we felt like we couldn't mandate options that did not have plastics for multiple reasons, partly because we also have to allow these to be given to individuals who are unhoused, right? And so we were weighing on like it becomes very complex.
Yeah, I'm very aware of that.
Yeah. So we tried to be very careful to in every single possible way call out metal or wooden options. And maybe we can do that with bottle, like for instance, like changing Tupperware. Oh, changing Tupperware to containers, for example. We didn't want people to be driven into plastic only options, right? And so we thought carefully about the word container, right? Because containers can be ball jars, can be snapware, can be, yeah.
Oh, well, yeah. And one of the things we always recommend are, if you've got a spaghetti jar or a peanut butter jar, wash it out and reuse it.
Yeah, I know.
That's
I'm a
that's the
ball
best
jar.
economic savings on those. But I, I I will just state this, which I'm sure is obvious to most people here, but anytime you're putting anything that's getting heated into plastic,
Mhm.
you're releasing and leaching chemicals that we know are not good for people for a variety of reasons. So any ways that we can reduce those exposures for vulnerable populations really has positive health impacts or mitigates negative health impacts. Maybe that's a better way to say it.
Sandra, thank you. And what we'll do is, this is a very appropriate, and you've raised this, so I'm not going to make you send that in an email.
Oh, okay. Thank you.
Right. And so what we'll do, and again, I want you to feel that in the kitchenware group and in the teaching kitchen group, we took your concern back, right?
I appreciate it.
And
Okay.
really waited.
Okay.
And what we'll do is try to think about it again, just to make sure,
Okay.
right?
I'm seeing, you know, where it says food storage, it says plastic. So again, any ways that we can stay away from any of that plastic, both for health reasons, but you know, there are huge environmental concerns around these things
Yeah.
also. So
Yeah, so plastic wrap is still there. But again, the containers was specifically changed to call out
yep, nope,
that
that's
the
great. That's
Tupperware
great.
is a problematic statement because it has
Yeah.
a plastic connotation, even if they're offering glass container options now.
Mhm, mhm. Yeah,
Yeah. Okay, we'll take that back. And Meg, you and I were responsible for putting that back through the lens. And again, very appropriate end-to-end review concept because we have a very good working draft. And we just want to see if we can really ensure it's meeting the health goals of the intervention.
terrific. Thank you.
Any other thoughts? I'm glad the adaptations to ensure cultural and personal accessibility feel correct. And I'm glad that, yeah, so and then Matt, we had a long conversation on adaptive stuff. So we have that as well. All right, great. Carrying on, if there's no further questions, next slide. So large kitchen appliances did not change because it really is just about refrigerators and freezers. And again, the reason why this was created for anyone who wasn't here when this one came to light, the reason why it is called out special is because freezers and refrigerators are used to store medications, even if it's a not food-related intervention. Right. So they're provided for housing, they're provided for individuals with like meeting certain medical complexity requirements. And so we needed to call this one out separately and have it be its own thing. And so this is the only one of the definitions that talks about medications and not just food. Does that make sense? Okay, I'm glad. Next slide. And we actually, in my FQ, we have a little teeny refrigerator giveaway program for just that. Not even related to a waiver. It's just a grant-based program to ensure rural individuals have appropriate refrigeration for refrigerated medications. So we added the same for small appliances because of the same exact conversation regarding really trying to ensure that we meet individuals' cultural and personal needs with appliances. We added that same cultural and personal preferences here. This way, it does not need to be like a robust list. And like in this way, we also make sure that if there's specific appliances that individuals feel are really critical, it can be part of the provision. So that's the only addition here. Any thoughts? Seems we good? We're doing good? All right. Fantastic. Okay. Next slide. I love the good end-to-end review. It's so like, And again, all of these will be available for downloading tomorrow. If you have further thoughts after this meeting, just send an email and we'll put it through the brilliant minds of our subject matter experts and bring back to you. So with the cooking, now we're on to cooking education, teaching kitchens and food pharmacies. And we really are focusing on just one, but we parsed out that there really were two separate concepts. There were nutrition classes that were not currently addressed by concepts in medical nutrition therapy that we addressed last session. And then there were instances that were really focusing on cooking skills that included nutrition education, but cooking skills were always part of it. So we're really focusing on the latter. Same, we'll have drafts available on the Confluence by end of day tomorrow. Download and disseminate them. And again, we just want to note that and I mentioned this on the interwebs, the food provision of these concepts really is handled by our phase one concepts, right? Healthy groceries and medically tailored groceries. So instances of things like food pharmacies, you go and you pick up your food and you learn cooking skills with the food, with exemplars of the food you have in your box. or cooking education could be the same way. So if you have food provision as a core concept in your cooking education teaching kitchen program, you can represent that food separately, right? Once those concepts come in. Next slide. All right, so this again has not changed since we last met. The core components are education components or education toward basic nutrition concepts and cooking skills development. So as we mentioned, the cooking skills are a requirement. The basic nutrition concepts include general nutrition, such as what people should eat more of, less of, and why. We talked about portions. We talked about portions and mindfulness in our last meeting, and we were kind of hemming and hawing, and it's kind of contained in what people should eat more of, less of, and why, but we're going to go more into that when we reconvene our SMEs very shortly. We talked about ensuring there's adaptations for cultural preferences in the basic nutrition concepts as well. And we talked about how it can, but doesn't necessarily have to, include diet-related condition prevention and management. And that's not meaning that if you're addressing somebody who has diabetes that you don't modify it, but sometimes instances are actually directly focused and grounded in specific conditions, and we wanted to allow for that. They even parsed out the skills, and we did this with a bunch of professors in the room, right? There's lots of nerds in that group. So the objectives of the education are understanding and demonstrating competency with the skills of food procurement and storage, food safety and safe food handling, creating and modifying a recipe, understanding tools, understanding how to safely use tools, basically e.g. knife skills as an example, and cooking methods and techniques. And then the last core skill, so we have basic nutrition, skills development, and the last core one for sustained change, adaptation of skills is the ever so critical culinary health coaching or motivational interviewing, which is a critical component for any skills education in order to maintain and move towards behavior change. Again, this hasn't changed very much. We did want to call out that there are emerging evidence-based curricula recommended but not required, and that multidisciplinary teams are recommended but not required. Any thoughts on this one since we last met? I think it's pretty great. We have the luck of having, many of the developers of the teaching kitchen model be part of our subject matter expert group, and we've gotten to a good spot. Okay. Barring questions, this again will be available on the Confluence tomorrow at the end of the day for download and review. Again, any changes that you feel like are necessary, please send an email. And then the subject matter experts, again, have a few more concepts in the hopper, and we'll come back in 2 weeks and further refine with you all. Next slide. All right, so I think that's the end of the coding for food section. It might be a Swift. I always say that and then it never is. That's the dangerous thing. So Meg's looking at me like, why'd you do that? So please feel free to stay with us if you came for the coding for food bit. Again, please do download. The end of this meeting talks about homework and next steps. If you are leaving, please go to the Confluence and download those drafts of the coding for food concepts and reflect on them. Send us an email if you feel like it needs to have a refinement, and then we will keep on moving towards our vote on May 29th. Okay, now on to program enhancements. Next slide. So the 3 topic areas we've been working on in program enhancements are analyzing all of our programs in order to see if they're complete. And that was the publishing of the lexicon on the Confluence, which was bye, Sandra, the first definitive list of Gravity programs, definitions, and references. So it's kind of a quick searchable list of is my program in here? The next core topic area was the program classification. I see some of our amazing program classification SMEs on the call. That one was the Herculean task of developing an open consensus program classification of programs for the purpose of navigation and connection to services. And then the last one was program documentation. And this is a consensus on method for documenting service delivery and program enrollment. And we're going to be going through some updates on the last two in the next few slides. Next slide. All right, so part of the first, actually, I should say all of three. We're going to go through updates on all three. So in the program analysis, these are programs we realized are gaps in our lexicon of programs. And so we are working on definitions and references, and we'll submit them to SNOMED, and they will go into the according value sets. And they also will be nested into the classification. So childproofing items, infant formulas, diapers, those all relate to infant needs. Grocery delivery, we didn't have that. We had an awkward term for how to get a free vehicle. And so we revised a free vehicle program. We didn't actually have core work clothing and work supplies programs, even though we referenced Dress for Success and programs like that in our unemployment domain. So it was about time. Free toys, educational materials, and then it seems like it's not placed, but it's only because it's part of the program classification and audit, refugee resettlement programs. And so all of those are getting definitions and references and will be part of our submission to SNOMED in the summer. Next slide. And then on to program documentation. Next slide. So the goal of this area of work was really to develop the concepts for the end result of interventions, right? We refer to SNAP. The person being enrolled in SNAP is the final outcome and goal. Same with WIC, same with a non-emergency medical transportation program, same with housing choice vouchers, same with all of the core, really federally and state underwritten programs that we have in the ecosystem. So we had to build concepts to represent that. So we're building the enrolled in blank program concepts. And we have an approach and method that we're going to be sharing over the next slides. Next slide, because we are not building those concepts for every single one of our programs. So the Gravity team reviewed all of the Gravity programs on the lexicon because it existed. It was helpful. We were able to use our own resource to determine what enrolled in program concepts should be built. And from a point of prudence, we took this approach. We wanted to ensure that we were capable of documenting person-level enrollment. We wanted to ensure all core national, federal, and possibly state programs that had associations with outcomes were capable to be documented. And we wanted to make sure that we were documenting specific programs and not general parents. An example of that would be like state utility assistance program, but there is no general state utility assistance program. There's a state arrears forgiveness program and a state rate forgiveness program, right? So we tried to document the specific programs that you would actually be enrolled in because that was the point of the effort. Part of what we're doing now is just making that initial take transparent to you on the Confluence because we made our initial assessment on, trying to be prudent and not build too many and not include things that you can't be enrolled in and ensure really the core federal needs are met. So we're going to share that with you on the Confluence, and you can look at it all and let us know if we did a good job. The draft analysis of Gravity programs for enrolled in concepts will be available on the Confluence by tomorrow, just like everything else. And what you'll see there is a kind of an assessment from Gravity, which is, yes, we think this should be built. Explore, we're not going to say no, but we're waiting for you to tell us if you feel like this needs to happen. Again, that would be implementer driven. And then no, like it just didn't qualify for enrollment at all and it didn't need to be built. So all of those assessments will be available on the Confluence by the end of the day tomorrow. Does this make sense? So this is the next step of us working toward that enrolled in blank program terminology. And you all can review and just let us know if we got it right. Dates will be capable of being associated with enrolled in, and there's also other ways of representing it in the model, and we're working on some of those concepts within our STU 3.0 update, and we encourage all folks who care about enrolled in concepts to go to the technical call on Wednesday from 1 to 2 because they'll be talking about that in detail. I hope that, Marianne, I hope that made sense. Yeah, so you can have enrolled in and it can have features and descriptions. within the resource. Okay. Oh my God. Okay, great. Lots of things. Matt, you had your hand open, and then Julianne.
Yeah, two quick questions. Did you consult with any of the state integrated eligibility and government benefit systems that like have the actual statuses, and the wording of those statuses in terms of enrollment? And then, yeah, I mean, I have another brief question after that, but
What do you mean? So you like for the actual, are you talking about for the statuses of enrollment? Are you talking about, because we're talking about the term here. The
Sure.
statuses are ever so critical for the technical resource in my mind, if that makes sense. Like the term enrolled in X program. This is like where gravity's confusing. So I need to better understand. Like we're talking in Gravity about building the code for enrolled in SNAP,
yeah,
right?
and
Yeah, yeah.
um, yeah, in terms of the, I guess I understand the concept of enrollment. I think that my question was like, just as part of your research, there are obviously state Medicaid systems and other service systems that do this API driven, not as much on the kind of SNAP side, obviously. But I was just wondering if, in terms of the lexicon, did you consult with them about what language they use to just say enrollment?
Oh, we did not, and we'd love to. Maybe we can make sure that they review the document on the Confluence.
Sure. And then the other core concept that I don't know, maybe you can point me in direction if it exists in the standards, is essentially this concept of like a program owner. The way, this is just an internal language that my company uses. So how we define that is like the organization representing the service is the organization that decides yes or no, you are accepted and now enrolled in the service, right? They're the determiner. Do we have an existing concept in the standards that delineates this concept? However,
Again, I'm going to recommend that brilliant concept be taken to the Wednesday meeting, because that is exactly the kind of thing that gets borne out in the IG.
Okay.
Right. And this is not to deflect, but we were talking through when we went in our internal meetings within Gravity, and I don't think Corey is here right now, but Corinne is here. But in our internal meetings before, when we prepare for the public call, we have absolutely discussed the concept of ownership and who gets to establish what and how to represent that in the model. And then just so we could be smart enough to bring it to you all on Wednesday. So that decision about ownership will have to be part of the solution, I think, from a SDU 3.0 perspective, if that makes sense.
and like it obviously gets even more complicated with like WIC, where you have like the enrollees, the organizations that are designated to deliver that service, and then you have the owner being ultimately the state. So it's, anyways, I haven't come up with a language that is the way it should be described, but I just wanted to just flag these.
Yeah, and that's a really good question of whether it's a language question or whether it's like is the term enrolled in blank the question, or is how it's represented and who gets to establish it the question? Because it's enrolled in WIC, regardless of, it seems to be, regardless of who has the authority to establish they're enrolled.
Yeah, I
Right?
think that the delineation I was trying to make is that the context in which this matters the most is how these services are described in directories, right? Because a lot of organizations will, like, if they're updating a directory, their information, they'll just be like, oh, WIC. And what they mean by listing WIC as a service is that they provide navigation to WIC. They don't mean that
Yeah.
actual. And so like just coming up with language so that we can like identify a class of services where there needs to be this multi-hop situation.
Yeah.
Right. And whatever we call it, I don't care. And then the class of services where there's a, whatever language it is, the owner, the one that is enrolling people. Anyways, rant over.
No, it's not a rant. And I 100% think that conversation needs to be brought to Wednesday. I have no question. And you know, Julian, former benefit data trust guy, now share our strength. He's like right there with you, 100%. Rolled in ex by data. Okay, and Julian, I'm gonna have you try to help me understand what we mean there. And then we are definitely, Julian, the way to represent patient to patient and household concepts, and Matt, I mean, you know how sticky this is. As far as capacity to represent household eligibility is something that is a challenge. And representing linkages is something that is a challenge and is something that gravity sits in the middle of all the time. And we'd love to actually bring that to the technical call as well, 100%. And I do want to note that some of that work is being explored in other work groups in the HL7 ecosystem, but it's very much gravity connected and related. And then Julian, do you want to say anything more about your comment?
Yeah, just to voice over that bit, it's when we say somebody is enrolled in a program, there are two potential sources of truth, at least two potential sources of truth. One of those is, and I'm sorry for my echo, I realize I'm meeting from two spaces, so let me, sorry. Okay, no more echo, folks. Yeah, so one of the sources of truth is like a state database, like linkage between a SNAP agency database and a healthcare agency database. And then there's also the, like a patient tells you, oh, I am currently enrolled in food stamps. Or perhaps after an application assistance event has occurred, you have a follow-up call with that patient to be like, hey, did you actually make it onto the SNAP program after I helped you sign up? And they say, yes, I have enrolled. So just noting there's kind of these like two different ways of
Yeah.
like confirming enrollment, and maybe that's like a modifier to the concept of enrollment. And there's also like kind of weird edge cases where sometimes the state data is out of date and this person's self-attestation is maybe like the newest and most truest thing, but sometimes the reverse is true where like your patient may be confused about what the program in question is and the state data is actually more up to date than the patient, and or sometimes documentation from the state, like sometimes if someone may be enrolled in SNAP but they didn't receive a letter from the state because they recently moved or they're homeless, and so they like don't actually find out they're enrolled and they didn't get their EBT card, but from the state's perspective they are enrolled, but the patient doesn't know that. So I'm just saying there's like complications around this.
Absolutely. And that's why like the same complexity, it's actually not too different, Julian, than the complexity we know with like medications. I think about like the various statuses of things and like, you know, ordered but not actually picked up. And, you know, so I think we're well accustomed
Yeah.
to representing complexities in something existing and verifying its existence within within statuses in a record. Right. And I just want to note there is a third option. So there's the state verification, there's the personal verification, there's also the program. I mean, like for programs that involve direct PC, like primary care to program coordination, like WIC, for example, like I'm communicating with WIC every like on the regular. Right. They need me to send them the formula prescription for the, for the kid with, eosinophilic esophagitis, right? I have to do so that, and same thing with like care management entities that have care management and do HMIS enrollment, right? So if you're the housing agency, they're letting me know the status of that all the time too, right? So there's state, there's program, care management, case management, care coordination, provider to provider, woohoo! I know, that's a dream, it happens. And then there's the person, right? Anyway, fun stuff. So some of this is regarding statuses, verifications, fire, tech, and then some of it is regarding terminology. But luckily, we're all friends. I will be at the call next week. I want to see all of you there. All of you need to come to the technical call Wednesday from 1 to 2 to share everything you just said. And I'll make sure I update Corey as well. Any other questions on this? All right, next slide. And again, this kind of relates, Matt, to what you were saying, because like enrolled in is really tricky with some programs that have very long wait lists, and we recognize that. Right? So like in Elena, I think about you every single time. I think about the difference between like being on like enrolled in the housing choice voucher program and actually living in a housing choice voucher house. Right? It is sometimes a year, decades of a gap, right? So we just want to note that as we're thinking, because really the point is to get to a point where we have our outcomes documented. This enrolled in is the first pass, but it may be that we actually have to come back through a second time and think through other concepts and other methods. And we already know we're doing that for some things that are like a provision concept, right? It's like this person got the thing, it was a one-off, they got it, or they got the thing every single time, like Meals on Wheels, like, or like medically tailored meals. Like there's a code for every single instance of receiving the meal, right? And that's going to be not an enrolled in concept. Maybe it'll be both, but it'll also be that they got the thing. All right. Next slide. All right, are we good with program? So again, our initial pass at the enrolled in X program concepts table is going to be on the Confluence tomorrow at the end of the day. And then the idea is really to just look at it and see if it seems sufficient. And I am going to charge, I will be at the call on Wednesday, and I'm going to want to see all of your faces there talking about all the smart things you just said. I know, Julian, you're coming. Matt, I hope you're coming too. Jonathan, I'd love to see you. Everyone come. All right, next slide. So now we're going to do classification. We hit a really amazing milestone a little bit ago. So super excited to share. Next slide. Our amazing subject matter experts, a few of them are on the call today. My word, you brilliant humans. It has been so far a year of work with 211 LA, Find Help, Epic, Unite Us, and 211 San Diego. Just amazing, critical national effort. I don't say this very often, but doing this was actually a response to a call to arms in the HHS data strategy. So when HHS data strategy was posted, this idea of an open consensus classification of social care programs for the purposes of navigation and connection to services, it was raised as a requirement for human and social services interoperability, and the collective answered the call. So just amazing work, friends. Next slide. And again, you've seen this all by now. You know, we're primarily working on the groupers and then specific programs. Again, the programs a person's enrolled in will be represented either by gravity or alternate taxonomies such as 211 HSAS. Next slide. This is I even put a little GIF on here. I was so proud of us. Big Grover fans, you have to forgive me. We finished! The subject matter experts finished every single one of the final domains a little bit ago, closing with navigation to services. Huge effort. It was a year. We attempted to have a virtual ice cream party. That didn't happen. But just so grateful for friends at Epic, Find Help, Unite Us, 211 San Diego, and 211 LA. It's just amazing. It's amazing work. And now we're just finishing the final elements, but we finished it a little bit ago and are now doing our final review before we disseminate it out into the world. Anyway, congrats all around. Amazing experts. Lena Kalinowski, I see you. Nicole, I see you. Keith, I see you. You're amazing. So big. On to populations next. Next slide. And the reason why I say on to populations next is we were very prudent in not building groupers for specific populations. And so populations for specifics on programs will have to be modeled elsewhere. And the team is up for the task. Go team. So we have a new draft final product for you available on Tuesday through Direct Care. That means we only have a few domains left for our final draft. We anticipate being done in the next couple weeks. And again, all of that will be ready for you on Tuesday. We don't have a ton of technical folks on the call. We do have some people who weren't here a little bit ago. And so I'm going to go to the next slide. So we are going to disseminate it. All of our friends are waiting for the final draft. I even just got an email inquiring. So looking forward to sending it out for intentional review. Next slide. We started having this conversation last time, and I don't think we need to get into it too far, but we are really at the point now of thinking about where we publish it and how. And so we need to figure out where it's represented, whether it's represented in a formal taxonomy, whether it's represented in the Gravity Confluence, whether it's represented in HL7 artifact. And we're getting closer and closer to figuring that out. But and if the groupers are going to be codified, how they will be. Next slide, and I'll show you what we're working through. So we have our grouper concepts, and we're trying to figure out, like we're working through building those out within a specific terminology. The problem with that is there's both program specific and non-program specific groupers. We'll talk more about that in a second. And then the program concepts are likely headed as it stands right now for SNOMED CT. That's because every single one of the programs is already defined within SNOMED, and so putting them in SNOMED CT is thought to be the easiest next best step. And then, so we have grouper concepts that need to be built. We have program concepts that need to be built. So just SNAP, not referral to SNAP, right? And I do want to note for those of you who are talking about statuses, even if we're building the enrolled in SNAP concepts because we have to at this state of interoperability and the state of FHIR, we do imagine situations and futures where, just like the med list, just like Julie and I were talking about, maybe those enrolled in concepts won't be necessary because everything can be represented in the model. Maybe there's a future someday where you just have your SNAP, just like you just have your, medication, and the information about that program for the person are completely represented within an interoperable model. That's not now. Also, the enrolled in SNAP concepts are really, really critical for quality reporting across different entities. So it might be some time, but we're just noting that that's a possibility in the future. Next slide. Lots talking today. So examples of general groupers and specific groupers. Programs that offer rides as a general grouper, that is challenging to represent in terminology. NEMT is a specific grouper, easy to represent in terminology. So these are just things we're thinking about when we think about where we're going to build it. Next slide. Any questions here before we go on? No? We're good. I think that's it. Any other final questions or thoughts besides Grover being incredibly proud of my amazing friends in the classification world, and all of you knowing that it is a call to arms to respond to the HHS status strategy?
So Sarah, did you, there's a comment, I don't know if it was brought up, Mary Ann said, I would imagine this is the technical call is where we'll talk about X disenrollment or completion of program.
Oh yeah, Marianne, I mentioned, I kind of vaguely went over that, but yes, right. So
Okay.
the time periods of programs, like figuring out, and again, that 1 to 2 call, like there's so many features of program that are required to represent in the exchange. Like, is there a duration of the program? Is there an instances? Are there units, right? So qualified for how many, right? So it's all of that is definitely technical call land. But I'll be there. 100%. Marianne, did I answer your question? I'm sorry I glossed over it. Okay, great. It's always nice to see Marianne Berger. Any other thoughts before we move on?
A quick question. Do we have a semantic definition for populations served of like what does it mean to be quote an elderly population, or there's
Oh yeah, we're doing that next. Yeah.
you have a value set for that? Great.
No, we don't have a value set for that, but
Right.
we, in order to not have a proliferation, and any of our subject matter experts who are on the call can answer this better than I can, but in order to not have a proliferation of possible program groupers, right? What we did is created a grouper that was generalized across all populations and able to have a program tag, like a population tag, right? And so that population list and the definitions therein is our next area of work, because this is not able to be fully operationalized. You can't like navigate and connect an elder person or a kid or somebody, in a non-elderly adult, like an adult disabled individual, or, period. You can't connect all kinds of people to the specific programs that they need without understanding those features of them, right? So that population set is our next area of work. And
And
it, go Elena, hi.
Oh, I was just gonna add, yeah, because I mean, Matt, to your point, like a lot of what something is often based on like who it's for, but to parse out those two axes of like really focusing on like what is this thing, and recognizing that oftentimes the who it's for is integral to what it is, and then but also for the purposes of like really defining those two axes so that they can be technically like applied in like a kind of versatile and like interdependent way. That's why we took the course of like, no, we will parse out to the degree that it can be what it is from who it's for, and recognize that we have to have the other axes in play to describe what's actually in the community.
Yeah.
And furthermore, it's going to be tricky in some instances to 100% define things, because sometimes definitions are driven by state statute. Right. I'm just going to note that, like you said, the word elder. Elder means different things for different states, for different programs. Unfortunatamente. Different like federal definitions versus state definitions versus program requirements. So fun task. I know the right people to ask. Luckily, the SMEs are psyched. Any other further thoughts? All right. If it's not obvious that I'm incredibly proud of the program classification SMEs, I hope you all, I can say it one more time. Most amazing dedicated group ever. Go team. A year. Next slide. And next slide. Homework. Next slide. Okay, download everything. We have Coding for Food draft definitions. We have the draft program classification tree. We have the draft of the enrolled in concepts, the programs we've picked for enrolled in concepts. There's a lot to review, and that's just the enhancements domain. In the new domain area, there's 3 master lists for our 3 domains as well. So it's suffice to say the terminology team is busy. So download these. Again, the only thing that's not going to be available tomorrow is the classification that comes on Tuesday, because Sarah B and I have some work to do. And we look forward to seeing you, and we look forward to seeing you all on Wednesday from 1 to 2, when Corey and Corinne and members and all of you help us walk through eligibility and enrollment use cases, hopefully bringing in all the smart things you said here. And then the new domain call is next week as well. Thanks, friends. We appreciate you. Thanks for coming.
Thank you, Sarah.
Bye.